to detect the coronavirus. They say measures are being put in place to keep South Africa safe from the virus. It's already claimed hundreds of lives in China and infected more than 4,500 people. Infections have been reported in America, in Japan, in Thailand, Europe, South Korea. It's spreading very fast. Joining us now in studio, Dr. Sibongile Walaza, a medical epidemiologist, I beg your pardon, from the National Institute for Communicable Diseases. Doc, thanks for coming in. Good to have you here in studio.
Good morning. Thank you for having me.
So, according to the reports, it looks like the virus at the moment is in the northern hemisphere, but it's spreading. Every day we're hearing of new cases in different countries. So, we really cannot think we're immune to this. So, but how are we sort of getting ourselves prepared?
Okay, so as you've mentioned that according to the recent updates, it is spreading to other countries. So what we've done in South Africa, already had systems in place for surveillance so that we can pick up communicable diseases. What we've done for this, in response to this, we've strengthened that surveillance so that we are able to rapidly detect cases and able to respond. And we've sort of updated and created protocols so to help the people at the front line so that they can easily and quickly identify cases so that we can respond and prevent further spread.
Let's take a step completely back now.
Okay.
What is coronavirus?
So a coronavirus is a group of, it's a big family of viruses. And in that group, you've got those that cause disease mostly in animals, and then some that cause diseases in humans. But then they just present with mild symptoms. But sometimes it does happen that the infection, the coronaviruses that affect animals, change in their genetic makeup, and then are able to then infect humans. Then when that happens, then it will get a new virus like the one that we have now. We have had others previously. Then that virus will then be able to cause an infection in a human being.
Yeah. Many are saying, and the thought is that it actually may have originated from snakes. Do we know this yet, or is that just a suspicion and they're still looking for where it actually originated?
At the moment, these investigations are still ongoing. The source has not been identified. But however, I mean, it has already been reported that most of the cases were coming from one area in China, and most of them have been in contact with a particular market, which has since been closed. But in terms of identifying the source, the exact source, that has not been confirmed.
That hasn't been confirmed as yet. So the spread of this, how does it spread? Because what we're reading and hearing about is that it is highly contagious and you can actually spread it without even starting to show the symptoms. So it is something that is hard to contain. But perhaps you can talk to us about that.
As with new viruses, then in terms of the full epidemiology, that is how it's transmitted and how it's spread and things like the incubation, that information is still sketchy. But however, as most respiratory viruses, so there's been a spread. I mean, most of the time then people who spread via respiratory droplets and also via contact, and the majority of cases are mostly presented with respiratory symptoms. So they suspect that's the best mode or the most efficient mode of spread. Yeah. But very few in terms of whether people who are asymptomatic can spread it to others. That information is still sketchy at the moment, but there is some suggestion that is possible. But most of the cases that have been able to presented have been in contact with people who are symptomatic.
Okay. What are the symptoms?
So most people present with fever and a cough, and some present with difficulty breathing. So when they've got a lower respiratory tract infection like a pneumonia, and yeah, so that's mostly those are mostly the common symptoms.
So it's actually quite hard because those symptoms could mean anything. I mean, you could just have a simple a case of the flu, or you may have bronchitis, or you may have pneumonia, not necessarily coronavirus. So the advice, what is the advice that you give people if they are feeling those symptoms?
So that's an important point that you're making. So it's the presentation is not specific, non-specific, but what we're advising people is that people who've traveled to areas where the virus is known to have circulated or have caused disease, it's important for them when they go to the doctor that they mention their travel history, or they mention that they've been in contact with a very sick person who's then had to travel. But yes, as you're saying, that it could be then from our side with the protocols, then we are able to screen and assess to see what is the likelihood. Should we go on and test, or is it another respiratory virus that's causing the symptoms?
Yeah.
So people, when they are not feeling well, then they should consult. But the important thing is a travel history and contact.
Relations between China and South Africa are massive. There's a lot of trade between the two countries. There's a lot of tourism, and of course it is also the Chinese New Year, and you'll find that a lot of tourists taking their holidays and they're exploring and adventuring out at the moment. So, you know, you're getting into aircraft, and we'll talk about OR Tambo in a short while, but the chances of that action, not OR Tambo, I mean, all the airports in the country will get there now, but you know, this, of course, I would imagine would increase the chances of this virus spreading more and more and eventually reaching South Africa with this relationship between China and South Africa.
Yes, correct. I mean, we've got a lot of Chinese in South Africa, but the good thing about the South Africa is that most of the, especially from the epicenter where the outbreak started, there are no direct flights to South Africa, and already the Chinese government is already screening patients that are going out and also in the areas where there's connecting flights. So hopefully those will be detected, I mean, will be picked up earlier. But in our situation, then again, we then provided the protocols for the people at the airports so that we do screening, which I must say was already existing, because already had screening for the fever at the airport, but then we just giving them the new case definition so that they can do more screening.
Has that system improved? Because I remember at one stage there was one poor man standing there with a thermometer as everybody walked past, because I mean now it's a desperate situation. You need to ensure, I mean, as far as I know, South African airports haven't put any additional security measures in place to monitor and ensure that people coming in and entering South Africa out of China are monitored. I mean, shouldn't we be a little bit more proactive in ensuring that one body with the virus enters the country should not go undetected?
So, I mean, as you're saying that you were mentioning that you had one person standing with a thermometer, but now things have sort of improved, because now they're using the, it's not the thermometer that you put on
no,
your mouth.
It's the one that gets
that
your
you put,
temperature.
yeah. So they do that. And then, yes, I guess, I mean, the main thing is providing information that, again, when people travel to China, we tell them that when they're there, they avoid contact with sick people and they avoid contact with the animals. But then when they come back and then they're not feeling well, then they should also alert the people at the entrance that they're not feeling well. So, but as part of the screening, we will then, I mean, the information, we're also looking at having the live broadcast on the screens at the airport to say, if this is what you're feeling like this, please make sure you get tested. So we're sort of improving tracing and finding those people. But what's important again is that once people are inside the country and they're not feeling well, the important thing is to say, go to your doctor and tell your doctor that you have traveled. So in the event that we miss them at the airport, if the person has got information, then they're able to go to their service provider and then they put into the system so that we can test them.
The major question, however, if that individual does present themselves at one of our hospitals or to a doctor,
yes,
are we prepared to deal with this? Do we have the adequate care, the adequate measures in place right now to deal with coronavirus?
We do have measures, and as I said earlier, we've already provided protocols. So the hospitals, I mean, they know what to do. So we've provided protocols that when they get a suspected patient, that they apply the infection prevention control protocols, and they'll be able to isolate the patients, and so that to prevent further spread to others. So we are prepared, and the hospitals have been informed, and they are expecting cases, and they do know what to do.
All right, we'll leave it there for this morning. Thanks very, very much for the update. That was Dr. Sibongile Walaza from the National Institute for Communicable Diseases talking to us about the coronavirus. Look out, these symptoms, they may just present themselves as normal flu, something that's very based to the respiratory system. If you do have that, just go and check it out. Don't ignore it. Just make sure that you go and get some professional opinions on and a diagnosis as to what you have. All right, 8 o'clock. Thanks again, Doc. Let's get your news.